Welcome to the Advancing Maternity Care podcast. I'm Ty Hagler, Chief Operating Officer at Couplet Care. In this podcast, we invite maternal, infant, and family health thought leaders to share their perspectives and work. Connecting around research and lived experiences is key for implementing more meaningful support for families and those who care for them. Today, I'm excited to speak with Dr. Lorenzo Hopper. He is an assistant professor at UNC Charlotte, specializing in maternal and child health and health equity, where he also served as the director of Masters of Public Health program until 2022. As a first-generation college graduate from Shelby, North Carolina, he earned his PhD from UNC Chapel Hill and a Master's of Public Health from East Carolina University. His personal journey as a Carolina Covenant scholar deeply informs his professional dedication to supporting students navigating the hidden curriculum of higher education. Dr. Hopper's research primarily examines the impact of paternal involvement on child development and the unique wellness challenges faced by first-generation students. Dr. Hopper also co-leads the Charlotte MCH work group and serves as a research fellow at the Moynihan Institute. Recently recognized as a 2024 National MCH Faculty Development Fellow, he remains a prominent advocate for intersectional health equity and community-based participatory research. Dr. Hopper and his wife also welcomed their firstborn a few weeks ago, making this a truly special time in their lives. We're excited to hear your stories and insights today.
Awesome. Thank you so much for having me.
Yeah. So I have to ask. So you've spent your academic time building up to kind of what it means to be the role of the father in this early stage and everything. Was there ever a moment where you were a little sleepy and sluggish in these early days, and where your wife turned to you and said, "Well, hold on, how's the expert in being a good dad coming along?"
Absolutely. Yeah. One of the funniest bits of reflection for me these last few weeks, studying fatherhood for 10 years and being
Mhm.
5 weeks in now, it's like, here we go. It's an adventure, it's a journey for both of us. She'll ask me questions from time to time, but we are both
Mhm.
navigating parenthood together.
Mhm. Yeah, that's good. Well, and how is sleep going right now? That's kind of the question everybody asks at this time, right?
Yep, finding the new normal. It's
Mhm.
definitely a challenge. My wife is amazing though. She's nursing throughout the night and we're starting to settle into a little routine where I'll get the early morning shift. I'm also a bit of a night owl, so I'm
Okay.
doing okay. I'm making it. Everybody's telling me that I look more rested than I feel, so I think that's a good thing.
I wouldn't be able to tell. You look like it's just a normal day. Well, good.
Thank you.
Well, Dr. Hopper, could you share maybe a little bit about yourself and maybe what drives your work these days?
Absolutely. So thank you for that introduction. From a small rural town, raised by a single mother and my grandmother. And I always prioritized sports and fitness and then my education. Being a first generation college student can be challenging. There's a lot of the not knowing what you don't know and kind of figuring it out as you go. So when I stepped onto UNC Chapel Hill's campus, as a first year student, it was truly a different world. And so along the way, was able to meet some fantastic mentors who introduced me to the field of public health and encouraged me at the right moments and the right times along the way. And so I just continued down that educational path. I prioritize it. It's always been rewarding to me. I see new information and knowledge as rewarding, but also a lot of pats on the back from being able to excel academically. So stepped into public health, started to learn about a lot of the disparities and challenges that many communities face, many of the communities that look like mine. So it just started to form new questions in my mind. And one of those was, how do we improve some of the maternal health and birthing outcomes, infant health statistics that have persisted for so long? And so that brought me back to UNC to pursue a PhD in maternal and child health. And I always knew that fatherhood was something that I had the most questions about. Again, growing up in a single parent household, it's like, well, how did my experience differ from a few of my peers who had dad in the house? A lot of father figures for me growing up, but that's what I had the most questions about. And to my surprise, there was a lot of limited work and research around how essential, how important fathers are for these different outcomes. So off we go. That's been the charger in my back as a researcher, and I enjoy being an educator as well, helping other students kind of navigate those waters.
It seems like you bring so much intentionality to every aspect of your life.
Absolutely,
Yeah.
absolutely. Yeah.
So maybe can you talk a little bit about some of your current work? I mean, some of the students, the kind of classes that you're teaching, and then some of the research you're leading.
Absolutely. So I get a chance to teach a course on maternal and child health, which I love because the field really grew out of protecting our children
Hmm.
from a lot of the child labor that was happening in our country. But at the same time, healthy babies and healthy moms are our future, truly. So
Hmm.
I get to teach a course on maternal and child health. I also get to prepare our graduate students to be health educators and talk to them about working in and with the community, being able to translate what they've learned and what they know into digestible content for people to empower them. Again, I think knowledge is so rewarding. And so being able to educate community on how to better take care of themselves and their community, that's what I enjoy on the teaching side. And then current research, in the middle of some data collection now, it's been really cool interviewing young men ages 18 to 25 about future fatherhood. So these young men are not fathers currently. Some of them have desires to be a father. Some of them are unsure. We even interviewed a guy who was like, "No, I don't, I don't see it for me." But that's been a cool study, talking to them about anticipated challenges and perceived support that they may need so that we can better educate and prepare young men to step into fatherhood. I think there's a pretty big gap there. So
Hmm.
that's been a cool one that we're currently collecting data for.
Oh, that's so cool. Is that linked to some of the events you've been a part of? I know you recently had the event was strengthening mothers, or supporting mothers, strengthening families. Yeah, could you talk about that? Yeah.
Absolutely. So I get a chance. I just you meet really cool people who are very intentional and passionate about the field of maternal and child health. So I met Dr. Janisha Brown. She's a physician in our area, and she founded WeBe, the Women's Empowerment and Birth Equity Institute. So we collaborated a few times, and I was invited to serve on the board. And so we were talking about what type of webinars and events that we wanted to host this past Black Maternal Health Week in April. And she was like, "How about a conversation around fatherhood?" I was like, "I love that you asked. Let's do it.
Sign me up.
Sign me up." I reached out to a few friends of mine who are colleagues and experts in the field, but from different angles. So, one person who works with young men about manhood and preparing them for the workforce, and then Juan Erby, who's a doula and who specializes in training fathers to be doulas and things like that. And so Dr. Bentu Gross and just Kelly Little, these were a group of us, and we were able to have a conversation for an hour. And after that conversation about why it's important to educate and empower men to step into fatherhood, to be the village for their partners and for their families, to strengthening motherhood and maternal health, my phone was blowing up. People want more of that conversation. People who are currently doing the work want to figure out how to better engage men and fathers in the work that they're doing. So yeah, that was a cool. I'm glad you were able to kind of see that one.
Yeah, well, so I mean, you've got so many different cool, like you've got your coursework, you've got your
Mhm.
research, you've got some of the outreach that you're doing. I mean, as you think about maybe that light bulb moment that goes off with a message that you have, it seems like you've got a number of them, but what's kind of that first surprise or kind of light bulb moment that happens for your students or the community as you engage with people?
Yeah, I think it's just how welcoming and the thirst to bring me into these current
Hmm.
spaces to talk about work that I've always been passionate about, but now these
Hmm.
past few weeks it's a different lens, right? Being a father, being able to step into that identity. I think the light bulb moment is when you have a student in the classroom who you can connect to a community partner who you work with, and then they can work together and start to build out relationship, and then that student goes on to graduate, and then they get hired at another institution, and then now they're in academia. That's something that I was attending a different panel discussion here recently with a mentee of mine who's now an assistant professor at Davidson College. And it's like, wow, like that's the light bulb moment. That's the what continues to kind of fuel my fire to work.
Yeah. Yeah, absolutely. I mean, that there's nothing more rewarding than being a good mentor and kind of bringing up the next generation. Absolutely. So, what do you want to see improved as far as conditions for maternal health? What do you see as some of the big gaps that are there?
Yeah, so I've been able to do some work around just communication that patients experience when they're in the clinical setting. I've had an opportunity to speak directly to fathers to hear just what where they think the barriers are, but more
Hmm.
importantly, how that makes them feel invisible, and not wanting to be engaged as much. And unfortunately, I had an experience myself throughout our labor delivery process where provider came in, had a 10-minute conversation with my wife, and was about to exit. And I was like, "Hi," introduced myself, and I think what I would like to see improved is more father inclusive
Hmm.
education, preconception all the way to discharge education, some father targeted postpartum resources, and training clinical staff to try to engage fathers and partners in those moments, because there is ripple effect, and the next time there's a prenatal appointment, he may not find value in being in that space. There's some conversation just around marketing materials, and I'm just interested in it all. When a father walks into a space and the posters are only mom and baby, even if it's
Hmm.
around infant feeding and support, I think it just kind of excludes him a little bit. And so I think by addressing some of those things, father's confidence will grow. They'll feel more
Hmm.
empowered and better prepared to step into parenthood and be able to meet some of the expectations of their partner, be able to support them in ways that they may not even know they need. So,
Hmm.
yeah.
I absolutely agree with that. I think the kind of sense that you're kind of on the side and not quite sure how to help, but trying to be supportive and, versus kind of having that, as you say, like inclusive, language,
Mhm.
that, like absolutely would make a difference. Okay, so if you had a magic wand
Mhm.
and you could make all of those kind of like those gaps go away, how would you know if that system of care is working well?
Oh, that's a good question. I think that system of care would feel good to the family. I think
Hmm.
patient satisfaction would improve. I think
Hmm.
ultimately maternal health outcomes would improve and disparities would weaken, right? With smaller. And I think again, father's confidence would grow.
Hmm.
It's a tricky one for me because mom and baby are so important and should
Hmm.
continue to be centered and prioritized. I've heard some conversation around expanding the field of maternal and child health to maternal, child, and family health and things like that. And
Hmm.
I don't want to take the focus off mom and baby, but
Right.
when we better support men and fathers to be that anchor for mom, then maternal health outcomes will improve as well. So with that magic wand, I think here we go. Families
Ah.
now feel better prepared for the exciting and joyful experience of parenthood. Oftentimes, we talk about Black maternal health, and unfortunately, it's through a lens that can create a lot of anxiety and stress. But it's such a joyous moment in a lot of
Mhm.
families' lives, and so, yeah, I think that's how we would see that the system is now working.
Right. Right. Which I think there's a long ways to go in that. And it seems like you talk about celebrating the peaks and was it surviving the valleys or just getting through the valleys, right? I mean, like
Yeah.
that seems like we've had a lot of peaks and valleys over the past periods here.
That's the big one that I talk to my students especially about. Life's about peaks and valleys, and they're gonna stack up. Celebrate the peaks, don't take them for granted, and get off of that high too quick. But then learn in your valleys. So that's
Hmm.
something that I try to pass along because it's really helped me throughout my journey as well.
Hmm.
Mhm.
I want to circle back to something just thinking about this, right? I mean,
Yeah.
like, there's the mother baby couplet, and without taking away from that, you're suggesting maybe a triad that includes the father, right?
Absolutely. Yeah.
So, I mean, how do you
Love that.
find that right balance there? Because we do want to make sure dad is included, right? Or the partner is included, right?
Yeah, I mean it's a tough question. It's one that I'm still
Hmm.
kind of on the journey of trying to discover. I think it's so vital to talk to families. We've done
Hmm.
some qualitative research with mothers and fathers, the couple together, because sometimes even those expectations or ideas on what it means to involve the father may not be in alignment. And
Hmm.
so again, I don't think including fathers does it takes away from maternal
Hmm.
care and mom and baby. I think it strengthens it. And so it's just
Hmm.
through that language that we can better push for that triad and
Hmm.
expand our thinking to include fathers.
Yeah. I mean, it seems like you just directly experienced that gap
Yeah.
with your own son just a few weeks ago. What do you think would have changed that? Would that be just training for the postpartum nurse, or what do you think is the, I don't know, the path forward from there to solve that?
Yeah, I think the entire team. So after
Yeah.
that panel discussion we were talking about a little bit ago, I was
Hmm.
contacted by an OBGYN out of Detroit, Michigan, who said we do a
Hmm.
grand rounds and would love for you all to come and talk
Hmm.
to the physicians, the medical students about this very topic. And I think that's what's needed. In a way, it feels very by design that
Hmm.
nurse and physician come in, focuses on mom, how's she doing, baby, how are you doing as well. It feels by design, and I think it's time for us to maybe not disrupt the design, but to expand it for sure, because again,
Hmm.
it's ripple effect. And then when you go home, the structure of being in that hospital room and having them come in every hour or 15 minutes, that goes away. And so
Hmm.
I would love to feel as empowered as my wife does to be able to reach out to the physician and say, this is something I'm noticing, without taking that to my wife, because you don't want her to be stressed out, right? And so I think fathers are oftentimes the first to notice when something isn't right. So I've got some things in the works now to really expand how we talk about urgent maternal warning signs, because I'm becoming more and more passionate and interested on how do we develop those materials for fathers, right? You
Hmm.
may be the first to notice some dizziness or a comment that doesn't seem quite in the norm, or some vision changes, or you may notice something about your child as well. And so I think those are all the different ways in which can engage fathers in this way. Yeah.
I just got goosebumps as you were talking about that. I mean, we've got three kids, and they're teenagers and kind
Yeah.
of at late elementary school. But thinking back to that time period, that for me personally, having that kind of framing going into the kind of postpartum period, so that it's your responsibility to watch out for these things.
Mhm.
That would have been so helpful for some of the health challenges we went through as a family.
Sure. Yeah. Yeah. Yeah, and I just keep wanting to go earlier and earlier. I know in our country, so many pregnancies are unintended, mistimed, unwanted, and
Hmm.
so when you talk to enough fathers, because fatherhood looks very different, right? I'm married. My wife and I just had our firstborn. We, in a lot of ways, planned it, and we're over the moon when it happened. But that's not everyone's reality. And you talk
Hmm.
to a lot of men, and the relationship with the mother isn't as strong, and that's a barrier, or with her
Hmm.
family. And non-residential fathers are fathers as well. So the avenue forward isn't going to look the same for everyone, right?
Hmm.
But if we can understand how impactful fathers are and understand the need to engage them, then I think there is a pathway forward.
Could you describe that a bit more? Maybe pull the magic wand
Sure.
back out?
Yeah, for sure. And everybody's journey is a bit different. And for me, I
Hmm.
just think if we can better understand, once pregnancy happens, once baby is coming, right? How essential the father, the partner is, being able to understand just the way in which stress manifests itself and the impacts it can have on mom and baby as well. I think maybe we could put down a little bit of the external factors that may be playing a role and allow men to show up and be present and communicate their desires and preferences as they step into fatherhood. That could be a big one. The challenges are certainly different for residential and non-residential fathers. So the one I would need two wands now. A different one,
Well, that
right?
nuance comes
But yeah.
from insight and research, right? Yeah.
Yes, 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 yes.
So, I mean, I guess as you're thinking about that a little bit more, I mean, and for the non-residential fathers, I mean, is that something that carries through in curriculum in school, or how does that, where do you feel like those conversations might best happen, kind of in, as, I guess, young men are kind of growing into fatherhood?
Yeah, I think that I go to the experts. A lot of people look at me as the expert, but I look at the community
Mm,
as the experts, the people who are doing the programming, the people who are already working with young men to
hmm
try to prepare them for life. I think let's also talk about future fatherhood if and when it happens, right? It happens for so many of us at different
hmm
time points. And unfortunately, it happens really young for a lot of men before. In the study that I mentioned earlier, talking to young men about future fatherhood, many of them have a list of goals that they want to work towards. They want to be able to earn and be financially stable. They want to be able to be intentional about where they are in life. And then when fatherhood happens, when parenthood happens at a really young age, it's I couldn't imagine, right? Being able to balance those two, still pursue those goals. So I think the community is already doing a lot of work around educating young men and women about life and kind of what's to come. Let's talk a little more about parenthood and start the education early.
hmm Very good. I
Yeah.
like your emphasis too on community, that
Mhm.
can encompass so many different people who can influence the lives of young men and women.
Absolutely. Yeah. 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 I meet with partners now who are specifically doing work for young girls who have a child and they're
Mhm.
experiencing some challenges with their living situation, right? I meet other people who are working with single dads and you work with other people in the community. So I think the answers are there and just connecting those dots, those resources.
So, like, do you have any of your research that's been into kind of how dads feel during those first few days in the hospital? Is that kind of part of some of your study in terms of that kind of first kind of labor and delivery and then postpartum moment?
It does come out. Yeah, it does come out. I haven't and spent intentional time
Mhm.
around the experience during the fourth trimester, right? Like right after you get home, which that would
Mhm.
be as we're talking now. I'm like, okay, I'm gonna
You are
write
living
down
it
some
right now.
notes. Yeah. One, I am living it now, but yeah, two,
Uh-huh.
definitely future direction because again, that structure is gone. People's
hmm
support system looks different. My wife's family is about 10 minutes away. I come
hmm
home, her mom is here, she's brought some food or is making some food. And so the situations are different. I think that what I have been able to pull from my research is that fathers and partners want to be present, but they don't always feel prepared and empowered to step in. And like I mentioned before, communication is so important. Everyone's co-parenting, whether you're married and in the same house or you're not. And so what does that co-parenting look like? And how can I better show up for you and for
hmm
baby and things of that nature? But those are the feelings that I'm starting to hear. It's like the preparedness, feeling not as prepared as you would like to kind of step in. Yeah.
Do you have any stories or anything I haven't asked you about you think would be important to share?
A good question. We do a respectful maternity care simulation at UNC Charlotte. So we bring in a
Okay.
community partner. We invite students and community and providers to come. And it's not really role play, but it's role play. They get a script and they kind of read it out. And I've been able to kind of be a fly on the wall for what those interactions are like. And so I think it can be tough, but there are just so many different opportunities to educate mom and dad, but then also educate physician and provider and nurse on how to make those interactions just more respectful. I think respectful care is just something that we hadn't talked about. And as I was just navigating this whole journey, I was kind of sitting back, just observing, maybe a little more than most, because it can be tough. It can be tough. We had a wonderful doula. So doula
Okay.
care is also, I think, important, who help to prepare us and get our preferences together. It doesn't always go to a T,
Mhm.
right? But I think that was essential as well. So those two things kind of come to mind as we've been talking here.
Yeah, so I've been hearing about simulation centers and
Mhm.
that ability to go through and like walk through a scenario and maybe give people a chance to get feedback on,
Mhm.
kind of an action that maybe a fellow clinician might have done and how to correct the situation. Is that part of the scenario, maybe? I'm just guessing. Like,
Yeah,
what?
no,
Okay.
the debrief part focuses one on how you felt in that moment, because sometimes the
Hmm.
role is the patient who isn't being
Mm.
listened to or who just has a negative experience. But then in that debrief point, I think those things do come up, like what
Hmm.
could have been done, right,
Hmm.
to kind of avoid that. So yeah, that definitely comes up in those experiences.
Hmm. But what I find so fascinating about this conversation is so I'd imagine any of the metrics the hospitals are following, like the degree to which fathers are included in the postpartum experience isn't really something that's going to show up on a dashboard.
Right. Hmm.
And
Yeah.
and yet that's a key part of, I think, the complete patient experience and
Hmm.
also setting the family up for the fourth trimester.
That's a great point. Yeah. I think even capturing just attending those prenatal care visits and
Hmm.
things of that nature is not necessarily going to show up, but you're right. And I think it just makes me ask more questions about, well, what kind of metrics could we kind of think about and develop and test
Hmm.
to see what the connection is to patient satisfaction or their delivery method or their health
Hmm.
outcomes in general. Yeah. Hmm.
Right. Well, and I was just thinking about outcomes too. Like if that drives towards better outcomes also, then that can
Hmm.
be the argument for putting more, like getting more magic wands out and putting better programs in place.
Yep. Hmm.
Yep.
Engaged fathers are impactful. They're impactful to
Hmm.
maternal health behaviors that we know are modifiable. They're impactful for once baby is here and early childhood development and continued development throughout. So, yeah.
That sounded like you had a few papers backing that statement up.
Absolutely, yeah. I can send, I can definitely send you the research. My dissertation was centered around father engagement and the impact on early childhood obesity
Hmm.
related behaviors. So screen time, fruit and vegetable consumption, sweetened beverage consumption. And I think it's important to let men know it's impactful, but both ways. So we want we want to practice healthy health behaviors, because child is going to mirror that. Whole family is going to mirror those behaviors.
Well, please do send those research links. We'll include them in the show notes.
Absolutely, will do. Will do.
And then as we wrap up here, I mean, I guess, do you have anything like a big message you'd want to take away
Mm-hmm.
for either expectant fathers or young men who maybe one day think about fatherhood as part of their future? I mean, what's a big message you want to leave them with?
Yeah, there's so much information out there. Is not really ever too early to start to educate yourself. We know more now about the importance of men's preconception health. Are you exercising and eating right and doing all those things, because it has direct impact on placenta development and
Oh,
childhood development. And so it's so much. But really, I just want new and expectant fathers and young men who fatherhood may be right around the corners. Feel like you belong in those spaces. You definitely do. There's always going to be moments where people are like, "Do you have any questions? Do you have any questions?" Ask those questions. Get those answers for things that you're thinking about, because it's going to help you. Again, it's going to help you to be the best father that you can be, the best partner you can be, and have the strongest family possible.
absolutely. Dr. Hopper, where can people find you if they want to learn more?
Oh, great question. So you can find me social media, Lorenzo Hopper, but also at here at UNC Charlotte. So you can contact me there. I'm on LinkedIn, Lorenzo Hopper as well. So reach out. I would love to continue the conversation with anyone listening.
Absolutely. Wonderful. Well, thanks so much for taking the time to talk to me today.
Absolutely. Thank you for having me.